Hi everyone, my name is Julianna, and today Daniela and I will be speaking about depression. Before we begin, we will just do a land acknowledgement for the Dish with One Spoon territory where Toronto and X University are located. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Our agenda for today will include the following: an introduction, what is depression, some statistics, types of depression, risk factors for depression, and what are the warning signs. Then I'll pass it over to Daniela, who will speak about treatment, misconceptions about depression, self-care with depression, supporting someone with depression, supporting a client, resources, and important points to remember. Nearly everyone will experience some form of depression in their lifetime. However, most of the time, this type of depression may be situational and the feelings of sadness and worry go away with time. This is not the case for all people though, as many people live with depression on a daily basis. There are many different forms of depression, all of which will be touched on in a later slide. Depression can be very scary, but it is important to note that it is treatable. Myths, misunderstandings, and stigma continue to be barriers to treatment for many people, especially men, and the consequences can be life-threatening. Depression is a serious and common mental health disorder that negatively affects how you feel, the way you think, and how you act. Depression can cause severe feelings of sadness and often leads to a loss of interest in activities you once enjoyed. It can lead to feelings of worthlessness, suicide, hopelessness, and can often lead to a variety of emotional and physical problems. Depression can also often disrupt your daily routine and can make it impossible to get out of bed some days, but it is important to know that you are not alone. In order to be diagnosed with depression, your symptoms of depression must last at least 2 weeks and represent a change in your previous level of functioning. Now I think it's important to note some quick statistics. Depression affects an estimated 1 in 15 adults. 1 in 6 people will experience depression at some point in their life. Depression can happen at any age, but the usual onset is during the late teen years to mid-20s. Women are much more likely than men to experience depression, but this does not mean that men's feelings are invalid. There is also a high degree of heritability when the first-degree relatives such as parents, children, or siblings have depression. This number is as high as 40%. There are many different types of depression, and some types respond to treatments differently. This is why it is important to seek medical advice if you fear you may have depression or are experiencing depressive symptoms. Types of depression include, but are not limited to, the following: major depression, persistent depressive disorder, seasonal affective disorder, postpartum depression, and treatment-resistant depression. We'll first begin with major depression. This is also called major depressive disorder and is the most common form of depression. Most people with this disorder feel depressed most of the time or for most days of the week. Some symptoms include loss of interest in activities, weight gain or loss, insomnia, feeling guilty or worthless, having thoughts of suicide. A doctor may diagnose you with major depression if you have 5 or more of these symptoms for at least 2 weeks, and at least one of the symptoms must be a depressed mood or loss of interest in activities. Major depression looks different for different people, as it could also make you feel anxious, distressed, melancholic, and agitated. Next is persistent depressive disorder. This form of depression occurs when your depression lasts for 2 years or longer. This term is also used to describe 2 conditions previously known as low-grade depression and chronic major depression. Symptoms include change in appetite and sleeping patterns, lack of energy, low self-esteem, and feeling hopeless. Next is seasonal affective disorder, or SAD. We have actually already made an entire video dedicated to SAD. SAD is a period of major depression that most often occurs during the winter months and typically goes away in the spring and summer. Next is postpartum depression. Some women experience major depression in the weeks and months that follow after childbirth. It has also been noted that approximately 1 in 10 men can also experience depression during this period. Lastly is treatment-resistant depression. Approximately 1/3 of people treated for depression try several methods without success, and this is called treatment-resistant depression. There are many reasons why your depression may not respond to treatment, such as having other underlying issues that make your depression difficult to treat. Your doctor may suggest less conventional treatment options in this case. It is important to note some risk factors for depression. Depression can affect anyone, but there are several different factors that can play a role in depression, such as biochemistry, genetics, personality, and environmental factors. To begin, biochemistry refers to the differences in certain chemicals in the brain that can contribute to symptoms of depression. Next is genetics. Depression is often a result of hereditary issues and runs in family gene pools, as previously discussed. Next is personality. Individuals with low self-esteem, those who are easily overwhelmed by stress, or those who are generally pessimistic appear to be more likely to experience depression than those who are not. Lastly is environmental factors. Constant or continuous exposure to violence, neglect, abuse, or poverty can also make individuals more vulnerable to depression. During episodes of depression, the following symptoms can occur most of the day, nearly every day. Feelings of sadness, emptiness, and hopelessness, angry outbursts or irritability, change in sleeping patterns, tiredness and lack of energy, weight gain or loss and increase or decrease in appetite, anxiety, agitation, and restlessness, feelings of worthlessness or guilt, frequent or recurrent thoughts of death, suicidal thoughts, or suicide attempts. Usually these symptoms are severe enough to cause noticeable problems in day-to-day activities such as work, school, or social activities. In children, the symptoms are the same as above, but there may be some minor differences. In children, the symptoms are the following: sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, and being underweight. In teens, they can be sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. If you or someone you know is experiencing any of these symptoms, they may have depression, and it is important to be there for this person.
Now we will discuss treatments. There are a few treatments available for managing depression, including medications and psychotherapy. We'll begin by discussing the different types of medications that may be prescribed. The first one is selective serotonin reuptake inhibitors, or SSRIs. This is often the first medication to be prescribed as they are safer and have less side effects. Some examples include Prozac, Paxil, or Zoloft. The next one is serotonin norepinephrine reuptake inhibitors, or SNRIs. Examples include Cymbalta or Pristiq. Atypical antidepressants may also be prescribed. Sometimes tricyclic antidepressants are offered by a professional. They can be very effective but can cause worse side effects. Often these will not be prescribed without first prescribing SSRIs. The next example is monoamine oxidase inhibitors, or MAOIs, which require a strict diet due to dangerous side effects with certain foods. Sometimes doctors will prescribe two medications, such as antidepressants and a mood stabilizer. Medications can take a while to work, and it can take even longer to find one that works for you, but stopping antidepressants without first discussing it with a doctor can be harmful. Another treatment option is psychotherapy. There are different types of therapy that can be useful for the treatment of depression, such as cognitive behavioral therapy or interpersonal therapy. This will help to pick up on negative thinking patterns and replace them with adaptive ones, as well as provide tools to effectively manage depression symptoms. Misconceptions about depression. There are various misconceptions about depression, and we'll begin to break a few of them down. It's important to discuss misconceptions as each of them perpetuate harmful stereotypes and stigmas and can lead to people avoiding treatment or opening up about their depression. The first misconception is depression is not a real illness. Many people assume that depression is due to sadness or weakness only. However, depression is a mental illness that can be caused by psychological, social, or biological factors and requires some form of treatment to manage it. You can just be happy or snap out of it. Depression is not a choice, and people cannot just make themselves happy because there is more to the mental illness, and with depression, there is a change in brain chemistry. The next one is depression happens after someone experiences something sad. Depression does not always occur due to sad situations, such as a breakup, because this is a situation where many people would experience sadness. Sometimes depression can develop for a variety of reasons, and it is more than just sadness. It is hopelessness, isolation, and sometimes suicidal ideation. Antidepressants will change someone's personality. Antidepressants alter brain chemistry, however, it will not alter personality. Instead, antidepressants target chemicals in the brain to alleviate symptoms associated with depression. And finally, depression only impacts women. This is untrue. Women are more likely to seek help for their depression due to societal beliefs and stigma surrounding men with depression. Self-care with depression. Self-care can be very difficult for people living with depression. However, it's an important part of taking care of yourself and can help manage symptoms. Self-care can look different for everyone and can sometimes be something as simple as eating a meal or drinking water in the morning. We will discuss some ideas for self-care that experts suggest. The first being, talk to a loved one. It may be difficult to open up about depression. However, it can be a significant step in self-care. This can be a show of strength and can remind you that you are not alone and have someone to talk to. Get professional help. Getting professional help from a therapist can be helpful. Professionals can provide you with tools and treatment options that will help manage symptoms. Discover what resources are available to you. Sometimes support groups can be helpful as they are a group of people with similar lived experiences who you can talk to and know will understand. Journal. Journaling can be beneficial and there are many ways to do this. Some people write about what they're grateful for, others write about their negative feelings so that they can challenge them. Whatever you choose to write about is up to you, but it can be a critical form of self-care, especially if you're not ready to talk to someone yet. And finally, create routines. Routines can be beneficial, especially when they're filled with activities that improve mood, such as exercise or an enjoyable activity. Supporting someone with depression. There are various ways to support someone living with depression, and things that can be done to help. This includes beginning a discussion. If you're concerned about someone, sometimes it's best to start the conversation. You can do this by saying that you support them, but are concerned and ask them what's on their mind. They may not want to talk, and that's okay, but ensure you are patient, judgment-free, and actively listen if they do speak up. Encourage them to find help. This can be beneficial as someone will not feel alone trying to find appropriate resources to help them with their depression. It can also let them know that there is nothing wrong with getting professional help. Learn about depression. By learning about depression, it can help to mitigate what stereotypes are present and can help you to understand the condition a bit better. Finally, self-care. It's important to look after your own mental well-being. This can be done by enforcing boundaries and ensuring that you take care of your own needs. However, there are also some things that should be avoided. This includes trying to fix. It can be difficult to understand depression and what it's like if you have not experienced it yourself. However, it's important to know that it cannot be fixed with positivity, such as just thinking happy thoughts. Instead, it can be helpful to let them know that they matter to you. Avoid providing advice. Providing advice and saying, "I understand," can be harmful when you do not have the experience of depression because while it comes from a good place, it can minimize their experiences and feelings. Avoid giving advice but practice active listening. Finally, providing an opinion on medication should be avoided. Some people do not like using medication while others do. What's important is to not share your feelings about what you think is right for the individual, but to support them in their decisions. Supporting a client. There are a few important steps that can be taken to help and support a client with depression. These include creating goals that are helpful and clear. Goals can help you with understanding where your client wants to go with therapy and what they wish to get out of it. It can also help them to understand where they would like to be when therapy either ends or when they work through different points of therapy. It is important to make sure that it is clearly and distinctly shared what they think their life will be like when their depression is gone or they learn to manage it. You could also deconstruct all or nothing patterns of thinking. When people are living with depression, they often have patterns of thinking that result in thoughts like, "I am a failure." This can be harmful for many reasons, and it's important to deconstruct this. By asking a client why they believe this and working on challenging this belief, it can help combat all or nothing thinking patterns. Ask them to rate their depression. This can be helpful as they rate a number from 1 to 10 and it provides a foundation for questions and an understanding of their mood, whether it is improving or not. From there, you can ask why it is maybe a 3 and not a 2 or a 1. Finally, making sure a client understands relapse and what to do. It's important that a client understands that they may relapse and has a grasp on what they can do to avoid a relapse or to manage symptoms if they come back. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We will conclude this video with some important points to remember. Depression is a serious and common mental illness that affects how you feel, the way you think, and how you act. There are many types of depression which may respond to treatments differently. These include major depression, persistent depressive disorder, seasonal affective disorder or SAD, postpartum depression, and treatment-resistant depression. Risk factors for depression include biochemistry, genetics, personality, and environmental factors. There are various warning signs that have been discussed, and there can be small differences for children and teens. To continue with some important points to remember, there are a few treatment options for depression, including medications and psychotherapy. There are misconceptions about depression that can be harmful and perpetuate stigma and stereotypes. There are methods of self-care that can be used when living with depression. There are ways to support someone living with depression, but it is also important to take care of your own mental well-being. And practitioners can use certain techniques in therapy that will help support a client living with depression. That concludes this presentation on depression. Thank you for watching.